Today we're going to share with you some of our work in policy engaging and driving some of the policy engagement work of the Lancet Countdown. I'm going to give us a quick introduction of what it is that we do, why we do this policy engagement work, why we reach out to partners like yourselves in taking this forward, what we're trying to achieve collectively, and then we'll hear from some great examples of successful policy engagement work that we've done over the past few years from some of our key partners. And then give a bit of an overview of how you can engage with us and what we're thinking about this year. We hope that this session will be informative to those organizations that are interested in working with us at the Lancet Countdown in terms of supporting policy engagement and action for health on climate change. So I'm hoping that this will be an informative conversation. We're holding this in a meeting format. It's not a webinar format. And that means that you can all unmute and speak. So we're hoping it will be an interactive event as well and that you can share your questions if you have them. So Manu, if you can share... Oh, there it is. Sorry, now I see it. Excellent. So next slide, please, Manu. As you might know, I'm Marina Romanello. I'm the Executive Director for the Lancet Countdown, and I work with the Global Lancet Countdown. Each year, what we do globally is publish these reports that you see on screen. These reports, we're coming up to the 10th annual report of the Lancet Countdown. Each of them have over 60 indicators that monitor different aspects of the links between climate change and health. They monitor the health impacts and risks of climate change for health. And they also monitor the actions that we're taking to tackle climate change and their implications for health. Actions in terms of adaptation, both within health systems and within systems that support health. Mitigation actions, so actions to reduce greenhouse gas emissions and what the implications of those actions or inactions are for health. We also look at the economic transition, the extent to which we're reshaping our economies and financial systems to support improved health and well-being. And we also monitor the extent to which key actors in society, policymakers, scientists, the general public, media, are understanding that climate change is essentially a health issue and that tackling climate change could be the biggest health opportunity of this century. So all in all, what we try to do with these reports is to showcase the health aspect of climate change and to produce evidence that underpins our core messaging that climate change is fundamentally a health issue and that tackling climate change through a health-centered approach could deliver transformational health benefits. I should say that these reports that are from the Global Lancet Countdown are complemented by regional reports. And we have 6 regional centers that also produce their own regional reports and produce their own policy engagement strategy. Today, in this session, we will focus on the Global Lancet Countdown approach, but I do want to highlight that we have 6 regional centers covering small island developing states, Latin America, Europe, Africa, Oceania, and Asia, that are also producing reports and also doing a lot of policy engagement, including through partners. So please do let us know if you're interested in getting in touch with them. Next slide, please, Manu. So as I said, the data in our reports consistently reveals the life-saving potential of climate change action, which is centered and which prioritizes improving health outcomes. And the backtracking of climate commitments that we're seeing is putting lives, health, and livelihoods on the line. But we know we still can do so much in terms of turning the tide and delivering a health future. And that requires every actor to put all hands on deck. This is a system-wide transformation that we need. And therefore, we do need to reach out to key actors across all strategic areas to ensure that that transformation happens. From our perspective, the Lancet Countdown is a research collaboration. So our task is to produce the evidence and the messages that come from that evidence on the links between health and climate change. We publish in the Lancet, we do scientific reports, but obviously we all know that those scientific reports are very rarely read in detail by policymakers. And that in order to inform change, we do need to have all of that evidence translated into actionable recommendations. And we need to ensure that it reaches the hands of those that can enact change, that can see that evidence and that can design evidence-based policies off the back of that. And there is where we work with you, with trusted local partners to help us translate those findings from the Lancet Countdown into recommendations that operate at the national or sometimes even subnational level to ensure that they can be translated into effective policies. Next slide. So yeah, the policy impact of our work is hugely dependent on you guys, and the collaboration that we have with our policy partners is essential. It really hinges on who delivers the message, how that message is delivered, and when it is delivered. So what we look to do in our policy engagement workstream is to partner with key influential national level organizations that can take the message forward of the health implications of climate change and that have the national authority or the authority in front of key policymakers to ensure that they can recommend, advise, and advance a health-centered response. So what we're looking to do here is not just publishing a policy document, but is to establish a year-long collaboration with partners that have credibility and access to decision makers so that each annual report can then be translated in ways that are meaningful. We also lean on national partners to help us target and to understand local policy landscapes, timings. Us working globally, of course, we don't have that sense of visibility or knowledge of the national level opportunities as our policy partners do. So leaning on these strategic partnerships to be able to identify those policy landscapes, the timing, key policy moments and windows of opportunities to target with our evidence to ensure that we're pushing change in the right direction. And obviously, we also work with our partners to jointly translate the evidence in the report, which often works at a national level, and we have national level data, but needs to be translated to influential policy engagement. The policy documents that we co-deliver for each year's report launch is an aspect of that, but obviously we are hoping to go much more beyond that, using those policy documents to effectively influence change. To do that, one of our key priorities is that our national level policy engagements and the work in partnership with influential organizations is in line with the broader and overarching core messages of each year's report. And this is really important to us. We do need to ensure that in our engagement at the national level, we are all pushing consistently in the same direction and in the direction of travel that the evidence shows we need to go through in order to tackle what is essentially a global crisis with national and subnational implications. So obviously, each partner will have their own priorities. Each partner will identify key priorities, key opportunities at the national or subnational level. But we want to ensure that all in all, we're all pushing in the same direction to tackle this global issue. Next slide, please, Manu. So what we do is, as part of this work and as a kind of starting point or almost as an excuse to drive forward this policy change, is to produce policy priority documents or policy briefs, which are designed as a tool for policy engagement. They are generally co-developed with partners like yourselves that have direct access and good knowledge, good awareness of policy processes. They advance the core messages and translate it to a nationally or subnationally relevant level. They're concise, they're decision-ready recommendations. We've learned over the years that our policy briefs, when we used to do them longer, they didn't get read very much, and that a two-pager is a lot more effective in pushing the message forward. So we're shifting from longer documents in policy briefs through to these very short policy recommendations documents, maximum 2 pages, maximum 3 recommendations. We found that that generally lands better than longer documents. And we want to time them to influence key policy windows. In general, we publish them alongside our global report, and that is because our global report gives some moment of visibility to the issue of climate change and health from the media, from the general public, from concerned policymakers. And that means that it can ride that wave of attention to land the right hands of policymakers, especially as they're looking towards the COP climate negotiations. That is just when we publish our report. However, in some cases, we've identified more potentially impactful policy opportunities, and then these reports get launched ahead of those more impactful national policy opportunities, and that is perfectly fine. Next slide, please, Manu. Right, so before we head on to the panel discussion, I'm gonna hand over then to our some of our key partners over the past few years. Dr. Mason Tabatabai, that has not only been a long-term Lancet Countdown author, an author of the report, but also has been instrumental in driving some of our policy engagement in Malaysia, in the ASEAN region, and way, way beyond that as well. Ian Colbert, that is the Executive Director of the Canadian Public Health Association, again, a very long-term partner of ours. The work that Canada has been doing in advancing climate change and health has been absolutely phenomenal, and Ian has been behind much of that. And Kathleen Richards from the Federal Assistant Secretary of the Australian Nursing and Midwifery Federation. Again, Australia is one of our other key areas of focus. We actually have a centre that focuses strongly in Australia. So we're going to hear from them about their experience. But before we go there, what I did want to note is we ask a lot of you guys, and we want to make sure that in the work that we do in partnership with you, you also get the best available product and that you can use it to drive your policy engagement work year round. One of the key limitations that we have, limitations between inverted commas, is, however, that we need to be truthful to the work that we do at Lancet Countdown and to what our indicators show. And that has often led to situations in which we're very clear about what cannot happen anymore. We're very clear that we cannot keep on financing fossil fuels. We're very clear that fossil fuel phase out is essential for health. We're very clear on where the priorities are from the scientific perspective. But in a world that is so politicized and where the fossil fuel organizations have so much power, that sometimes puts organizations in very difficult positions. And we know that people's jobs, people's livelihoods may be on the line if they have to stick out their neck and speak truth to power. So in those cases, what we do is we empower those organizations with the evidence that they need to drive change. But in every case, we need to ensure that the policy recommendations documents reflect the science. So in some cases, when that isn't possible from the partner's point of view because of an enormous amount of pressure that they're under, what we suggest is, rather than co-branding with that, we will empower you with the evidence and support you to deliver policy documents that work within your context without necessarily being a Lancet Countdown document, which necessarily needs to be anchored to those key evidence points that we're generating. So I'm going to hand over now to our panel discussion, and they all have very good examples of how they have navigated a very political and very complex landscape at the national level. So please do take it on, our great panel, and I think Manu is going to be chairing this discussion.
Thank you so much, Marina. Lovely to have all of you here. Just to remind everyone, we will have a dedicated session on question and answers towards the end. But in the meantime, if you want to pop in any questions in the chat that you want to address, the panelists to address, feel free to add them on the chat. And towards the end, we'll have 10 minutes for you to unmute yourself and ask further questions more directly. So as Marina said, we're very pleased today to be joined by three partners who have worked with the Lancet Countdown on health and climate change across different moments in its evolution and across very different national and institutional contexts. And together they bring long-standing experience, institutional memory, and fresh perspective on what it takes, not just to produce these very impactful outputs, but to translate evidence into real policy influence. So what we're interested in today is impact and how these products have actually traveled into policy spaces, what they have influenced, and how that influence was designed from the onset. We've seen very strong engagement, particularly within the medical and health community with our products in the past. And the ambition now is to go even further, reaching deeper into government decision-making and maximizing policy uptake. So today, the discussion is about learning from your experience to understand how we can strengthen that impact also in the next phase of our work. Marina has very kindly introduced the three panelists here with us today. With all three of them, we'd like to explore how credibility and policy influences are built, how policy audiences are identified early, and how these outputs actually translate into impact. With that, I would like to start off by asking a question to Caitlin Richards, the Federal Assistant Secretary for the Australian Nursing and Midwifery Federation. Caitlin, from your perspective, how has lived experience been integrated into the messaging of the policy document? And through what pathways was this combined evidence from the Lancet Countdown from the actual lived experience, from the Nursing and Midwifery Federation that you represent, then disseminate it to governments. And I would like you to spend a little bit of time talking about which of the pathways that you worked on actually led to meaningful engagement or traction. So I'll hand it over to you to introduce yourself and go over some of these questions.
Thanks, Manu, and thank you, Marina, and to the team at the Lancet Countdown on Climate Change. It's been very fortunate that we've been able to partner this year as Australia's policy partner. Last year with the Lancet Countdown. And it was a real point of difference for us to be able to engage in this way, because obviously we are the largest union and representative body for nurses, midwives and carers in Australia, which means that for our membership, we know that it's really important for us to be acting on climate change, because we see firsthand the impacts of climate change on the health outcomes of our patients and clients that we're working with. So to be able to use that, leverage the 356,000 members' voices to advocate not just for action on climate change, but also to see that there's adequate adaptation and resilience measures as well, was really, really exciting for us this year. And last year. I say this year because a lot of the advocacy work that we've been doing has really elevated and amplified, which I'll touch on in a moment. But before that, I suppose for us as a policy partner, we sort of looked at the process in two key phases. Obviously, there was the development of the policy product that we had shown up on the screen there just a few moments ago. And we were really fortunate in our authorship team at the ANMF to work with really skilled representatives from across the federation. So we had branch representatives that looked at different state and territory jurisdictions and gave that sort of local and contextual feedback. But also our authorship was made of predominantly nurses, midwives and carers. So they had that experience of what it means to be on the floor and also understand what it means for healthcare workers in seeing the realities of these policy changes and really speak to that experience. So we sort of worked in the early phases quite closely, not only with our members in seeking their perspectives on the things that would make the biggest difference to patient groups, but also obviously with the Lancet in reviewing the critical indicators that would inform some of the things that we needed to shift the dial on to see changes in health outcomes. But we also really worked closely with key partners across Australia from different organisations, some from the union movement, as well as we worked really closely with the Climate and Health Alliance, obviously the Oceania region. And these partnerships were really impactful because one of the key things that was alluded to earlier by Marina was around identifying the policy landscape. What are the contemporary issues that we need to address with the legislative framework, and how can we be really, really clear on how we change the legislative and policy framework to achieve better health outcomes. And so in the early phases, we spent a lot of time in that consultation, and I can't overstate the importance of that work, because it later was really important when it got to the advocacy and the dissemination of our policy product, because it wasn't just one voice, one organisational voice that was bringing forward a particular message. We were comforted and also really relied on the authority, not only of our professional authority, having the experience of bringing the nursing and midwifery voice, but also working with a vast body of different organisations who had varying different remits, but also coming together on that shared platform. So that early phase development of identifying policy priorities and really looking into the legislative framework that we could advance change was critical. And then when it came to dissemination, there were a few key initiatives that we progressed. We launched it with a formal webinar, and we're really fortunate to have an expert panel presenting our policy product to not only our membership, but also the broader climate and health community. And then from that webinar, we really leveraged a series of targeted contact points with critical decision makers in Australia around our policy asks. We set up individual meetings with these key decision makers, but we also did a series of advocacy events in person in Canberra, where our Parliament House is. A highlight of that experience was one of the key partnerships that we'd formed was with Renew Australia for All. And they brought together, I think it was 80 of us in Parliament House one day. And one of the key asks that we had in our Lancet Countdown policy product was around funding the National Health and Climate Strategy. So that was echoed in other advocacy work that Renew Australia for All was doing, which meant that when we got to Canberra, had 80 of us, there were 80 people who were amplifying this message that we had in our policy product. That day, we met with 47 key decision makers, including key ministerial officers and the Prime Minister's office. And one of the things that I think had the biggest cut through and the biggest impact was having people who had experiences of climate change in their work, particularly health professionals, and having that voice coming through really honed in on why these policy changes were important.
Thank you so much, Caitlin. And I think one very important point that you've brought up is the importance of further partnerships for advocacy and taking that forward. And I would like to highlight that a little bit and hone in on it as I ask my next question to Mason, who has been involved since the very early years of Lancet Countdown and has been working in middle-income country contexts, to ask him about the importance of partnerships in ensuring that there is credible and impactful policy engagement or uptake of the key messages. And can you point to some examples where this has been useful, especially coming from an academic background and taking that forward?
Oh, thank you so much, Manu, and thank you so much, Marina. It's a great pleasure to be with you this evening here in Malaysia. I've been very privileged and honored to have been involved with the Lancet Countdown since 2017. And I have led the Malaysia launch of the Lancet Countdown report since 2019. Over the past 7 consecutive years, we have systematically scaled the quality and the policy relevance of the efforts. At the beginning, I was largely university-based, if you like, with very limited external engagement. But the key shift came with deliberately built strategic partnerships, starting with Malaysian Medical Association, in short, we call it MMA, and that immediately positioned the evidence within the core health community and gave it national credibility, if you like. From there, basically, we expanded through MMA. So that was the beginning. That was a very important milestone. And then we managed to expand our effort through MMA and the context that we had developed into the Commonwealth Medical Association, in short, CMA, which amazingly connects medical association across over 50 countries. This was, in my opinion, transformative because it allowed us to move from national engagement to a multi-country platform, including Malaysia, Sri Lanka, Kenya, India, Jamaica, India, and others. So this basically work that we established enabled us not only to organize launch events across multiple countries, but to translate, I think more importantly, translate countdown evidence into policy relevant outputs. And that really interested me then and now. For example, we have developed multiple Malaysia policy priorities or briefs over the last few years. We also supported a similar effort in Sri Lanka. We couldn't have done it without CMA engagement because they basically connected us to medical universities in Sri Lanka, for example. And they developed the first Sri Lanka national policy priority based on the Lancet Countdown report findings. And that was really something very important for the country. And they tried to place it in the context of the national data. And then we managed to get engaged a very productive team in Sri Lanka. and it was basically very rewarding, the whole experience, and I was very proud to be a part of it. Although my name never appeared anywhere on those documents, and that made me even happier because I was a part of an effort, a national effort, and I managed to basically, through my experience, empower local medical doctors and health professional, and then they led the effort afterward, and this was really rewarding. So these outputs were grounded in global countdown data, and that was critically important because we managed to critically adapt those data using local data, context, and stakeholder input. And I think that made them credible to policymakers, if you like. So the most important lesson I can highlight here is that credibility does not really come from the data alone. It comes from who carries the message. And that's what I learned through this effort. So by working through trusted entities and institutions like MMA, CMA, and maintaining long-term engagement through workshops, committees, and continuous dialogue. So we ensured that evidence was not just produced, but actually taken up in policy discussion. And that was really something we really valued. And another outcome that I can highlight, originating from the establishment of this network, was that for the first time ever, CMA basically started a committee on climate change and health and sustainable health. And that was very important because it never existed. So it came into existence through the partnership with the Lancet Countdown. And now it's a very important committee under CMA management, expanding across multiple countries with its own secretariat and members. So it's also very critical to highlight that CMA now sees the Lancet Countdown as a key reference point for climate health policy and a key partner. So basically, they constantly refer to the Lancet Countdown reports. They in every gathering the CMA management or EXCO organize, and I think that's something that the Lancet Countdown has achieved through this critical partnership with the CMA. So this partnership has allowed us to reach over 50 countries and the National Medical Association without spending a single pound. We have basically generated, through constant engagements, and I should extend my sincere appreciation to the central team in London because they have been nothing but support through the last few years, and they have felt this as well. So they have felt that there is a strong backbone at the Lancet Countdown. There is a very strong structure of support whenever needed, wherever needed. So I believe that this partnership has been critical. And if you ask, I would say that looking ahead, our focus is to deepen this model, leveraging this partnership to further embed evidence into national policy processes across all the countries we have access to. Back to you, Manu.
Thank you so much, Raisam. And with that, I will move on to Ian. Given that CPHA operates across multiple levels of government and you work in a very complex government setup, I would like you to focus on discussing how you decide who your primary policymaking audience is. How do you identify these stakeholders? And how does that shape the document and the engagement processes and discussions that come out of this partnership? So identification of stakeholders and making sure that the messaging and work is targeted towards that. Ian, I'll hand it over to you.
Thank you, Manu. So there's always the risk in creating a document aimed at everyone that it ends up resonating with no one in particular. It tells a story, maybe describes the problem extremely well, but there's no hard-hitting points that drive towards action. So we started from the question, where are decisions being made in the near term that could realistically shift health outcomes related to climate change? Really looking at the environment, the context in which we're working, and pinpoint, was there a decision point coming up? So in our case, that pointed specifically to our federal government, ministers and senior officials responsible for health, environment and climate change, as well as housing and finance. Particularly given the timing around our federal budget cycle, which had shifted, unexpectedly shifted, and as well as the federal government's move from a commitment to the actual implementation of Canada's national adaptation strategy. So at the same time, Canada is a federated model. And so we can't treat this purely as we couldn't just choose the federal government as our sole audience. In Canada, our provinces and territories hold significant responsibility for health systems and housing. So if federal action is going to translate into real world impact, it has to land in a way that the provinces and territories can support and implement. That meant we were thinking about a dual audience from the outset. Federal decision makers as the primary target, with provincial and territorial ministers and officials as essential partners in uptake of those recommendations. Now, the structure of the document itself, short, highly targeted, actionable recommendations, which was a big shift for us over the past decade, from telling a story to being hard hitting, and there were some growing pains for us along the way, but the format was driven by the Lancet Countdown process, and in the end, we're really grateful for that change. And the format worked in our favor. It forced discipline. Each recommendation had to connect to a clear policy level that federal decision makers could act on, while still being framed in a way that provinces and territories could see their own role in implementation. We weren't writing a comprehensive assessment. We were offering a small number of entry points into an ongoing policy process, and hopefully an ongoing conversation with those decision makers. Now, that clarity also shaped how we framed the narrative. We led with health system readiness, population health impacts, and practical co-benefits, rather than positioning climate change as a standalone environmental issue. This helped engage actors across portfolios, particularly those in health and housing, who may not traditionally see themselves as part of the climate agenda, but are directly responsible for managing its consequences. Where the audience decision really influenced impact was in the outreach. Because we had identified both federal and provincial territorial actors as critical, we were able to sequence engagement rather than treat it as a single launch event. That included targeted briefings with federal officials, outreach to provincial and territorial ministers to build alignment where potential federal measures and follow-up meetings with officials across levels of government, where there were some of the most actionable levers sat. So really trying to find where were those opportunities where we could influence change. Of course, we worked hand in hand with our partners, the Canadian Medical Association and the Canadian Nurses Association, to reinforce consistent messages across different entry points into government. I guess in practical terms, this didn't guarantee immediate policy change, but it did mean the report showed up in the right places and hopefully close to the right time. The recommendations were specific enough to be picked up in policy discussions, and the dual audience approach for us helped ensure they weren't seen. The recommendations weren't seen as solely a federal ask, but as part of a broader shared policy agenda. That's often what influence looks like in our system, creating alignment across jurisdictions so that when a policy window opens, the groundwork for action is already in place. Back to you.
Thank you so much. That was really helpful. And I would like to leave some time for Ellen to go over the entire process of bringing new partners in and leave some time for the question answers. So I'll quickly just ask the final questions for our panelists. Just in one line or one word, and you've touched on this in some way or another in your existing answers already, but could you, in one line, tell us what is the one thing that you would prioritize from day one in this policy partnership to maximize policy impact now that you've gone through this processes once in Australia's case or multiple times in the other two cases? So I'll just let all of you answer quickly, starting with Ian, and then we can move back to Mason and Caitlin.
Thanks. I think it would probably be quiet early engagement with key federal and provincial officials to refine recommendations and build ownership. It's creating a partnership outside of the health, the authors of the report, to engage them in that process. Often working with lower level officials who actually need documents like this to make their argument up as they brief up within their systems. If we know what they need, then we can help adapt the report so that it actually meets their needs as well.
That's a very important point. Mason?
Yeah, I really reflect on that question. So if I were to start again, the one area I would prioritize much earlier is grassroots engagement. So I believe so far much of our efforts has been at the institutional and policy level, working with medical association, government stakeholder, and international networks. However, what is currently missing, in my opinion, is a strong and systematic connection with the general public, the everyday layer of society where perceptions, behaviors, and ultimately political pressure are shaped. So in the next cycle, I would more intentionally engage with the Minister of Education, not only the Minister of Higher Education, but school level systems to embed climate and health narratives early. I think that that's really key. And I would also invest in reaching the cultural and social dimension of society, working with individuals and platforms that shape a public discourse on a daily basis. So this includes a strategic engagement with media, social influencer, and community leaders, those who are already aligned or can be aligned with the broader narrative of climate and health. Because ultimately, in my opinion, deeper policy influence requires not only top-down engagement, but also bottom-up demand and societal alignment. So I strongly believe that bridging the gap between high-level evidence that we produce and everyday understanding is the next frontier for impact. Back to you, Manu.
Thank you so much, Mason. That's really helpful. Finally, Caitlin.
Thank you, Mani. And I think Ian spoke to this beautifully before around really having a critical and key understanding of the policy window. Obviously, going through this process of developing the product, as Ian pointed out, it gives you that you can hope that a window then arises and you've done the hard work, which fortunately for us in our advocacy work, particularly around fossil fuel subsidies, it opened up quite nicely at the beginning of this year. But I think perhaps a key takeaway for me is looking at mapping that policy window at the outset, what those critical moments might be, and then perhaps adjusting the policy asks to meet that window.
Thank you so much. Caitlin, Ian, and Mason will request you stay on the call till the end so we can ask everyone on the call today to ask questions directly to the panelists and the broader team. But before that, I will hand it over to Ellen to go over some of the key requirements, etc., of the entire process. So, Ellen?
Thank you. Can you hear me? Yes, thank you, Manu and our panelists and Marina. I want to start by discussing how the policy priority documents fit within our broader partnership model. Policy priority papers are designed to be a year-long partnership to ensure that evidence is meaningfully translated into policy. Towards this, applicants should have a clear understanding of which policy stakeholders they aim to reach and actively use our messaging and data in that engagement. You should also use the policy priority document we co-develop as a proactive, practical tool for change by pushing it to policymakers through events, policy roundtables, letters to members of parliament and other legislators, and other creative avenues that draw on your existing networks. With this in mind, I'll walk you through the selection criteria, what we're looking for, the support we provide, and the application process and timeline. Next slide, please. Okay. So the first is who's eligible to apply. We invite our national or regional health professional bodies with established policy engagement functions, such as medical associations, nursing associations, midwifery, public health, or equivalent professional associations. Also, academic institutes are eligible only when they are in formal partnership with a qualifying medical or health professional association. Note also that unfortunately, we are not able to co-produce with NGOs or civil society organizations. Next slide, please. What we're looking for our selection priorities, we will prioritize applications for which partners, I'm sorry, getting a bit of an echo. We will prioritize applications for which we have a commitment to a year-long collaboration focused on policy impact that have direct alignment with ministries, regulators, and policy processes, that have the capacity to translate evidence into actionable policy asks, that feature established channels to drive uptake beyond the publication of the paper, and that are able to outline a credible, sustained pathway to government engagement over time. And click yes. So questions you should ask yourself before you apply. Which policy moment are we trying to influence? How do we already engage these actors? What pathways exist for uptake and influence? And is it possible to sustain this engagement over a period of a year? So the support that we provide includes, while we are not able to offer financial support, successful applicants will receive a year-long partnership to translate evidence into national impact, joint support to shape policy-relevant recommendations via policy priorities, strategic support for convening policy dialogues, events, and engagement with stakeholders, expert input and speakers from the Lancet Countdown network, both globally and regionally, and visibility and amplification through our Lancet Countdown global platforms and launches. On the timeline, we launched this application process in April, and the webinar today is to provide additional information and answer your questions in advance of the application deadline, which you can see here is May 18th. Selected partners will be notified in June, with the drafting process anticipated over the summer, July, August, and into September. Our global report publication and some regional reports are scheduled to launch in October in advance of COP, and the policy strategy documents can be integrated into launch events, used in policy roundtables, and aligned with other events. Then the goal is to continue disseminating and working the policy priorities over the course of the next year. And with that, I'm going to open the floor for your questions. If anybody wants I see a question in there. Could you please show the initial slide of what participants should include in the application? Manu, can we go back to that, please?
And then while we pull that up, I just wanted to clarify about our partnership with NGOs or civil society. So we, of course, really want to work with NGOs and civil society. They're crucial in this transformation. It's just that these specific documents were designed to be delivered by health professional bodies and medical associations, because that's the voice that we want to have discussing the evidence in front of policymakers. For civil society organizations that want to work with us, we have other routes of engagement, so please do reach out if that's the case. And in response to the UK Health Alliance on Climate Change, the reason why we work with them is that they bring together various medical professional bodies. And in that sense, they represent the voice and then they will engage with those medical professional bodies to ensure that the message is taken forward by those organizations that have a lot of policy influence. If that's the same case to Ola Nordum's question, about the Irish equivalent, then as long as the deliverer of that message would be the health professional organization, then absolutely yes.
Thank you, Marina. I see Amira Elwine has a question, please.
Yes, hello.
Yes.
I'm an assistant lecturer at the Faculty of Dentistry, Alexandria University, Egypt, and I was planning to apply as a representative of our institution. But I can see here that you said that we can only that academic institutions can only apply if they are partners with the Lancet or something.
So can we go to that slide, please? Yeah. We are asking that applicants partner with a national or regional health professional body who focuses on a medical association, a nursing association, midwifery or public health association or equivalent. And sometimes those structures look a little bit different in different countries.
So we can apply, but we don't have to be formal partners with the Lancet or something.
I think by doing, no, we don't, you don't have to be a pre-approved partner with the Lancet Countdown. You need to have these partnerships in place to produce the policy priority paper. Manu, do you want to add anything here?
Yeah, I was just going to say, if there are relevant national professional bodies, Amira, in Egypt, that are medical associations, nursing associations, public health associations, you would need to partner with them to apply. So nothing to do with Lancet Association. I also wanted to highlight, Ellen, there's multiple questions in the chat. So there's one question, if Ellen or Marina can take it, on government national public health institutes and whether they can apply. And again, a similar question on research institutes working around climate science and policy and whether they can apply. To the latter, I would say it's the same thing. You can, all academic institutions and research institutes can apply, but only if they have partnered with a national or a regional health professional body. So you will need to partner with a medical, nursing, midwifery, public health, or equivalent organization in order to apply. But Ellen/Marina, if you want to take the first question.
I see there's a question from Ma'an Zars. I'm
Sorry,
sorry,
Ellen, can we just respond to the questions that
Sure, go ahead.
Manu just read out?
Yep.
So in terms of partnering with governmental national public health institutes, that gets a bit tricky because generally the recommendations are for government. So it depends on the extent to which your government national public health institute is part of the government or whether it's a separate entity that brings advice to government and accountability for government. So an arm's length body. If it's an arm's length body, then it could be. But if it's within government, then it will be the target of the document rather than the author of it, if that makes sense. So it would be otherwise as the government recommending to itself how to enact those policies. In that case, what we would recommend with you is that we discuss, if you're interested in getting your national government public health institute involved in some of this work, we can discuss how to do that and how to get to some kind of commitments or position points and a different type of document that might work a lot better for the purposes of a governmental organization, which we find incredibly impactful if they're willing to look at the data and produce a response to it for sure.
Thank you very much, Marina. Yeah.
Shall we move on? Ma'an Zars has a hand up, and then there's some other questions in the chat.
Yes, can you hear me?
Yes.
Okay, great. So I'm Maan. I'm from the Asia Pacific Observatory, and it's hosted by WHO. So I think my question is more of what will be the role for the regional bodies. So we are a research partnering with different ministries, and we also have a consortium 56 partner consortiums, academic, and some are NGOs, and some are direct with MOH across 26 countries in Asia Pacific. And since you are focusing on the national level actions and engagement, I'm just wondering like what will be the role of regional health bodies on this? Thank you.
Marina, do you want to try that?
Yeah, man. Well, we expose a lot the national level. We do, for example, do regional or global work as well. So really interested
Mhm.
in understanding about the opportunities on your end to produce policy recommendations. If you have a clear way into influencing policies, and if you have such a big base of members in the organization, then absolutely very interested to discuss what that might look like. To give you an example, in the past, we have done policy documents with the World Medical Association as well, which obviously represents medics around the world at a global level. So we definitely can do not only national or subnational, but also
Mm.
regional or even global, if that could be an interesting output for your organization.
Oh, yes, thank you. And I'm wondering if part of that can also be like mobilizing country partners. Like, for example, currently we have three consortiums on climate change and health, and one consortium is composed of 5 to 7 institutes from different countries. So that's how we actually work. So we are working at the regional level, but we have a network of consortiums in different themes and different countries. So
Yeah, it might be that you want to focus on a country level or more regionally. It
regional
kind of
level.
depends on the
Okay.
opportunity. So we would prioritize a good opportunity to influence policy or to influence policymakers over the
Mm,
format. So what we can always do, man, is maybe take this offline and see what the opportunities look like on your end. It might be that the
mm,
format that we have as a cookie cutter, so to speak, for this type of policy priority documents is not the best use of the network that you
mm,
have, and you require
mm,
something slightly different. So this goes to
mm,
everyone in this call and any interested partner. We're here addressing the current open call for partners for policy priority documents, which follow this format, is something that we know how to deliver. It can be done with
mm,
very clear guidance. But if there's other opportunities to take our evidence and develop some policy engagement work off the back of it, we absolutely can think about different formats of
yeah.
both products and engagement campaigns.
Okay, thank you.
All right, so I think the next question is, so you can't apply as an individual even if you're a member of a professional body. That is correct? Okay. What are other alternative pathways to partner with the Lancet Countdown? Marina, I think you just answered this to a degree, that people can contact us and explore other opportunities. We're just talking today about the policy priority papers, but we love to hear from people who are interested in working with us. Is there a form to complete to submit? Manu, do you want to answer this?
Yes, there is a form that you have to submit. It will ask you key questions about the sort of audience that you're trying to influence, the pathways that you want to disseminate these messages through, etc. The form is linked on our website on the call for collaborators, and I've shared the link on the chat.
In
So
the
you can
chat.
access it through the chat.
Okay. Are there any other questions? Okay, Verso is the employers' organization of the Flemish Social Enterprises, an umbrella organization that encompasses 7 sectoral federations, 4 of which are from healthcare and welfare. Climate change is a theme that is taken up to the level of Verso and not at the sectoral level. Can we apply?
I'm not very familiar with Verso, but happy to take a look at that, Just. And if you want to drop us a line, we can see what would work and what wouldn't. From the very brief description, I'm thinking this might not be the most suitable output for the type of organization that you're dealing with, particularly because of kind of that employers focused. But of course, very happy to discuss. And as Ellen mentioned already, this is just for the current open call. The link is in the chat, and it's for the national, mostly the national policy priority documents, subnational or regional, if there's a good opportunity for that as well. But just to say, our core priority is to ensure that the evidence in the Lancet Countdowns report, which is very rich and which works at different geographical levels and different governmental levels, is used by policymakers to enact change. So if you have a good policy opportunity, if you have a good way in, even if it's not through one of these co-branded policy priority documents or this particular format of engagement, we're always more than keen to hear from those opportunities and see how we can best work with all of those organizations that have a way into influencing policy in using the right evidence to ensure that that policy does protect health.
Thank you, Marina. We can also, where applicable, connect you with the relevant regional center, which can be helpful as well. I don't see any other questions in the chat. Here's one. Can a professional body of multidisciplines, One Health Bangladesh, in which members are public health specialists, doctors, veterinary professionals, environment specialists, apply?
Yeah, for sure.
Okay. We're coming up on the hour. Any other questions? If we can see the last slide on our screen.
We have
one more question.
Okay.
Hi, thank you. You can probably hear me okay. It was just to clarify, that was the question from Ireland in terms of we have, what's the Climate Health Alliance in Ireland is the kind of equivalent to the UK Health Alliance. And we have all the sort of relevant members in terms of the medical bodies and all of that are members of that. But it also includes, say, active transport groups. There's even a football club that's a member. So there's like non-medical and non-healthcare members as well. But it's very, I suppose, healthcare heavy. Would that be, and I suppose, like coming from my point of view in Ireland, like that be the ideal organization to apply through because they will bring them all together. But it is, I suppose, yeah, it does have other groups as members. In addition to that, the Irish Healthcare Service is also a member of that coalition. So that's probably a problem.
I think all that the priority there, and we can discuss on a case-by-case basis, there's a lot of gray areas and professional bodies work differently in every country. So very happy to take a closer look at this. Our priority would be, is it an organization that is recognized as an authority in the protection of health at the national level? Does it speak with the voice of the healthcare professionals that are part of that organization? And does it have credibility in front of policymakers to ensure that they can influence them? If you think about other medical professional bodies, I don't know, the School of Pediatricians, for example, in many countries, they are the ones that advocate for policies that protect the health of children and youth. That's why we want to partner with them, because they will be the ones that are best positioned to advise policymakers and governments on which policies need to be put in place in the response to the medical and scientific evidence to ensure that those populations are protected. If that is the case also for this organization, then that might absolutely be the right partner for us to work with.
Yeah, no, they tick all the boxes you say there in terms of getting in front of policymakers and all of that. They probably are the most powerful voice in terms of climate change and health in Ireland. So,
excellent.
Yeah.
Well, thank you, everyone. Before we close, I want to point out that Manu's got her email address up on the screen there. So if anybody has any follow-up questions, please direct them to Manu, and she will make sure to give you a good answer, and if necessary, route you elsewhere within the Lancet Countdown. I want to thank you all for joining, with a special thanks to our panelists, Caitlin, Mesam, and Ian, and also to thank Manu and Marina for your work on this. We look forward to your applications, and please be in touch with any additional questions. Thank you very much.
Thank you so much, everyone.
Thank you, everyone.
Bye.
Bye-bye.
Thank you.